Hi everyone, today we are going to see what are intrauterine devices. So, an intrauterine device, also called an IUD, is a plastic T-shaped device that is inserted into the uterus to avoid pregnancy. It is one of the most commonly used contraceptives and has an efficiency of more than 99%. Let's take a closer look at an IUD. It is very small in size, measuring a maximum of 32 mm in length as well as width. Here's a reference image to show you how small it really is. IUDs have a T body with two arms, a drug reservoir and removal threads. These removal threads aid in the periodic check of the IUD position as well as for the device removal by healthcare providers only. On the basis of the type of drug used, IUDs can be classified as hormonal and copper-based. Both work differently, but their ultimate aim is to prevent pregnancy. Hormone-based IUDs contain the female hormone progestin. They increase the thickness of cervical mucous plug, making it difficult for the sperm to reach the egg. Additionally, they also make implantation difficult by thinning the uterine lining. They may also inhibit ovulation, similar to oral contraceptives. Copper-based IUDs make the uterine environment unwelcoming for the sperm as well as weakens it. Copper primarily acts as a spermicide, thus preventing pregnancy. How are IUDs inserted? IUDs should be inserted by a healthcare provider. The appointment is usually short and the actual procedure of insertion lasts only a few minutes. First, the doctor cleans the cervix with an antiseptic solution. Then, the provider will insert a tube containing the IUD in the uterus via the vagina. After this, the provider will push the IUD into the proper position inside the uterus with a plunger. The provider will then gently remove the covering tube and plunger to leave the IUD in place. The two strings of the IUD are positioned within the vagina but outside the cervix. As easy as this may sound, please note that IUDs can only be placed by licensed healthcare providers. Some pros of using IUDs are they are highly effective as a contraceptive method and have an efficiency of over 99%. They are long term and can last for 3 to 12 years depending on the type and the brand. They are quite convenient as there is a minimal post-insertion care involved. It is pretty cost effective even though the upfront cost of purchasing the IUD and getting it inserted might be a bit high. IUDs can be removed easily. This makes them a reversible contraceptive in case you decide to try to get pregnant. Some cons of IUDs are the insertion may be uncomfortable or even painful for many individuals. IUDs do not provide any protection from sexually transmitted diseases. IUDs can only be inserted by a licensed medical professional. IUDs may cause ectopic pregnancy, which means pregnancy in areas other than the uterus. This happens in rare cases only. I hope this video has helped improve your knowledge about intrauterine devices. Don't forget to like, share, and subscribe to our channel.